to be performing the physical therapy portion of this video.
Hi, my name is Kelsey Michaels and I'm going to be the patient for this video.
Hi, I'm Jamil Dictato and I will be filming this video.
So in this video we're going to be measuring hip internal rotation using a goniometer.
According to AMA, normal hip internal rotation range of motion for adults is 40 degrees. According to AAOS, normal hip internal rotation range of motion for adults is 45 degrees.
Okay, the goniometer has been shown to have good concurrent validity with an interclass correlational coefficient of 0.88, and the test-retest reliability is also good with an interclass correlational coefficient of 0.90.
There are no primary hip internal rotators in the anatomic position. However, once you flex your hip past 90 degrees, the ability of muscles to produce internal rotation increases, such as the piriformis. Some muscles' secondary action is internal rotation. These include the anterior fibers of gluteus medius, gluteus minimus, adductor longus, and adductor brevis.
As the Newman textbook has shown us, the convex surface of the femoral head actually rolls anterior and glides posterior in the acetabulum for the arthrokinematics of hip internal rotation.
Some reasons why you would want to measure hip internal rotation is if you suspect your patient has a hip muscle contracture, if your patient has just had a hip or pelvis fracture, and if you notice that your patient has excessive retroversion, meaning they walk with their toes out, or excessive anteversion, meaning they walk with their toes in. I'm going to list some contraindications now for why you would not want to measure your patient's hip internal rotation. You would not want to measure your patient's hip internal rotation if they've just had a hip replacement, if they had a hip dislocation, and even if they have femoral acetabular impingement.
So before you start the actual measurement of hip internal rotation, you would have the patient actually sitting at the edge of the plinth. You would have the landmarks exposed that you will be measuring off of. I'm also going to place a towel underneath Kelsey's right leg here so that you have her femur lined up at 90 degrees. You want to make sure that she's actually facing straight forward, that there's no actual abduction or adduction at the hip. So before I even use the goni, I just wanted to make clear what we're talking about. This is the stationary arm. This will remain stationary. This is the axis. This is the point from which I will be moving the movable arm of the goni. So I line that up as so. Okay, so as a therapist, you want to make sure that you have good body mechanics. I'm coming down to the level of the surface that I'm going to be measuring from. In this position, and actually in this case, I'm actually going to raise the bed up a little bit to get more at the level of the patella. So that'll be right about here. So we'll be positioning the axis on the anterior surface of the patella. The stationary arm will be perpendicular to the floor, and I'm actually going to point it between the malleoli, the lateral and medial malleoli. And the movable arm will actually move with Kelsey's leg, as so.
You should be aware that if your patient lacks hip internal rotation, they will try to compensate by leaning their trunk, by tilting their pelvis and raising their hip, or attempting to raise their knee.
So we've just looked at the positioning of the goniometer. Before I actually even take a measurement, I want to make sure that Kelsey can move through the internal and external range of the hip motion. So I will actually make sure that we can move in this direction before we can go in the internal rotation. This will provide a more accurate measurement. You want to make sure that you're zeroed out with the goni. My hand will be placed here at the distal femur, and I will shore the range this way. This hand here is to prevent any excessive abduction or adduction or flexion at the hip as we're taking her through this range of motion. Another position that you might want to put the patient in to measure hip internal rotation is in prone, as Kelsey's demonstrating. you would just have the patient bring their leg up to a 90-degree angle like this. You'd be taking the measurement from here and then show your patient the direction that you want to move them. You can do this as long as there's not tightness at the rectus femoris.
And you would use your same bony landmarks as you did sitting.
Hi Kelsey, my name is Marty Bach. I'm going to be a physical therapist today.
Nice to meet you.
So we're demonstrating hip internal rotation. So this is a goniometer. This device is used to take measurements of joint rotation, and it allow me to document, what range of motion you're doing at this time. So during the course of your therapy, we might be able to see a change as you're progressing. So this kind of gives us a snapshot in time of how the joint is looking. Does that make sense to you?
Yeah.
So I'm going to demonstrate. First, I'm going to see how you look going in this direction here. This is measuring rotation. So I'm just moving you here. How does that feel right now?
That's okay.
I'm also going to take you back this way. And come back out this way. So when you're ready, I'm going to have you, can you demonstrate that for me, coming out like this? Okay. So try to position. I notice that your hip is coming up a little bit off the table. So I want your hip to just try to stay in place as you come up. So right about here. Can you move it that direction and hold it for me right there?
Yes.
Okay. I have a measurement of 35 degrees. Active range of motion. So relax your leg for me, and I'm just going to move you myself in that direction, and I'm just going to take another measurement. Okay, can you hold that in place there? Okay, I get a measurement of 37.